What if I told you that the biggest threat to your heart isn't the medication sitting in your pill organizer? It's everything happening around it. I've spent more than 2 decades treating people with heart disease, and I've met countless patients who never missed a single dose, yet they still developed unexpected heart problems. These patients followed every instruction, attended every appointment, and truly believed they were doing everything right. Yet many continued struggling with rising blood pressure, worsening fatigue, irregular heart rhythms, or even unexpected heart attacks. Naturally, they all asked the same question: why is this happening? The answer is surprisingly simple. After the age of 60, medication doesn't work in isolation. Small daily habits that seem completely harmless, can quietly change how those medicines work inside your body. And most people never realize it's happening. Today, I'm going to share 6 common mistakes I see again and again. They're rarely discussed during a short doctor's visit, but understanding them could help you have a much more meaningful conversation with your healthcare provider and get better results from your treatment. Before we begin, remember this. This video is not about stopping medication. Many heart medicines save lives every single day. Today's goal is simply to make sure your treatment has the best possible chance to protect your heart the way it's meant to. Let me tell you about someone I'll call Margaret. Margaret was 71 years old. Every Sunday afternoon, she carefully organized her pills into labeled compartments: morning, afternoon, and evening. She never forgot a single dose, not even once. Her children admired how responsible she was. Her doctor appreciated how carefully she followed instructions. On paper, Margaret looked like the perfect patient. But despite doing everything right, something simply didn't make sense. She felt exhausted almost every day. Walking to the mailbox left her short of breath. Her ankles slowly became swollen. Margaret blamed old age. Her family blamed retirement. Friends simply said, "That's what happens after 70." For nearly 18 months, Margaret believed them. Then one day she visited our clinic carrying a shopping bag filled with prescription medications, vitamins, herbal supplements, and over-the-counter remedies. That single bag changed everything. Looking at everything together revealed the real problem. Her heart medications weren't necessarily failing. Instead, her daily habits and additional products were quietly interfering with how well those medications could protect her heart. That realization completely changed her treatment plan. As a cardiologist, I've learned something medical school never fully prepared me for. Treating heart disease isn't only about choosing the right prescription. It's about understanding the entire person and everything happening in their daily life. Sleep, nutrition, hydration, stress, other medications, supplements, even the timing of someone's morning coffee. These seemingly small details often determine whether a treatment works exactly as intended or whether it quietly falls short of its full potential. I've watched patients improve dramatically, not because we discovered a miracle drug, but because we identified simple everyday habits that had been working against their treatment for months or even years without anyone realizing it. Think of your medication like a key and your heart as the lock. The key may be perfectly designed, but if dirt fills the lock, or if the lock changes shape, the key can't do its job properly. The same thing can happen inside your body. As we age, our kidneys filter more slowly. Our liver processes medications differently. Muscle mass naturally decreases. Water balance changes, and even stomach acid isn't the same. The exact same pill you took at 45 may behave very differently at 70. That's why paying attention to daily habits becomes more important, not less, as we grow older. And I want to be absolutely clear. None of these habits mean your medication is bad. Please don't stop taking anything because of this video. Instead, think of today's discussion as a checklist. If one of these habits sounds familiar, write it down and bring it to your next medical appointment. Sometimes one simple conversation is enough to significantly improve your treatment. Let's begin with dehydration. Most people associate dehydration with hot summer days. But adults over 60 frequently experience mild dehydration because the natural sense of thirst becomes weaker with age. Many don't realize they're dehydrated until it's already affecting their health. Here's the hidden problem. Several heart medications depend on healthy circulation to move properly throughout the body. When you're dehydrated, blood volume decreases, your heart works harder, blood pressure fluctuates, and kidney function may temporarily decline. I've met patients who complained about dizziness every morning after taking their blood pressure medicine. The medication wasn't necessarily too strong. They were simply taking it after waking up already dehydrated, making the side effects much more noticeable. For some people, drinking a glass or two of water, when appropriate for their medical condition, became part of the discussion with their physician. That's why it's important to ask, am I drinking the right amount of fluid for my heart condition? The answer isn't the same for everyone. Patients living with heart failure may actually need fluid restrictions, while others may benefit from drinking more. The goal isn't guessing. The goal is creating a personalized plan with your healthcare provider. Now let's talk about supplements. This one surprises many people. They assume that if something is natural, it must also be harmless. Unfortunately, that's not always true. Fish oil, turmeric, ginseng, garlic extracts, St. John's wort, and even common vitamins can sometimes interact with prescription medications. Some supplements change how medications are absorbed or processed. Others increase bleeding risk when combined with blood thinners or reduce the effectiveness of important heart medications. The biggest challenge is that many patients don't consider supplements to be medicine at all. I once treated a gentleman whose blood thinner became extremely difficult to manage. After reviewing everything carefully, we discovered he had started several herbal supplements recommended by a friend. Once his healthcare team reviewed everything together, his treatment became much easier to control. One simple question can make a huge difference. Should any of my supplements be reviewed alongside my prescriptions? Never assume your doctor already knows what you're taking unless you've personally told them. Now let's talk about sleep. Most people believe sleep only affects energy levels, but it influences far more than that. During healthy sleep, your heart finally gets an opportunity to recover, your blood pressure naturally falls, and stress hormones begin to decrease. When sleep is poor night after night, everything changes. Blood pressure stays elevated longer. Stress hormones remain active. Inflammation increases, and irregular heart rhythms become more likely in some individuals. Even effective medications may appear to stop working as expected. I've seen patients ask for stronger blood pressure medication when the real problem turned out to be untreated sleep apnea. Once their sleep disorder was properly diagnosed and treated, controlling their blood pressure became much easier without adding more medication. That's why I often ask patients something they never expect. Not, what medications are you taking? Instead, I ask, how well are you sleeping? Sometimes the answer to that one question explains problems that dozens of prescriptions never could.